Welcome all for the today's session. Today we are going to cover very important topic, that is ARCP outcome. Okay, so this will always be asked as a SBA or EMQ. Most of the time it is the EMQ which is asked, and these EMQs are something like you expect the this particular question and you get the marks. Okay, so you prepare this, hardly few options are there, and if you make be thorough with this, you will get full marks of it. Okay, so basically there are total 8 outcomes. Okay, out of which only certain outcomes are more frequently tested. So we will go into the details of that. So, okay, so what is outcome one? Okay, ARCP outcome one. So that means it is a satisfactory progress. So the competencies are achieved as expected. So candidate has achieved the competency, or trainee has achieved the competency as it is expected. There is no additional time which is required because all competencies have been achieved as per the expectation. So it is actually sort of happy training. It is a standard progression. Okay, so outcome two. Now outcome two is some competencies are lacking. Okay, so this needs a targeted development. Only on certain competencies the development is little lacking, but no additional time is required. So minor deficiencies, but progression is allowed. Okay, so outcome one and outcome two, there is not much difference. It is actually the competencies are achieved as expected. However, here there are some competencies which are lacking, but to get that improvement in those competencies, there is no additional time which is required. Okay, so here it is the competencies are completely achieved. Here some competencies are lacking for which additional time is not required. The candidate can progress to the next step. Okay, next is the outcome three. Here you should remember the outcome three is you have to understand it well. Outcome three is inadequate progress. Okay, so here there is an inadequate progress. There are certain significant gaps and which requires additional time. Okay, so what we notice that in outcome two, the additional time was not required because some competencies which were lacking, which were minor, that can be coped up with this along with the next curriculum. Why? In outcome three, it is an inadequate progress. There are significant gaps. So unless these gaps are fulfilled, there should not be further progress. Okay, so it is the most important examination outcome that the candidate requires extension. Okay, so there are some significant gaps which have been noted. That is the outcome three. Now let's see about the outcome four. Outcome four is the worst outcome. Basically, it is the candidate is released from the program, the training is terminated, there is some serious failure on unsuitability of the trainee for this particular program. That is the outcome four. Okay, now coming to the outcome five. Outcome five does not mean failure. You have to understand very clearly what exactly the outcome five is. Outcome five means it is an incomplete evidence which is produced to the ARCP panel. Then it is a insufficient documentation is there. That is the main cause. Extra time may be required, may not be required. We do not know because we ARCP panel cannot judge and cannot give the proper opinion about it because the evidence which is submitted is incomplete. Okay, so most of the time the candidate does not get confused over this on outcome five. Okay, so actually here it is not the competence issue, it is the documentation issue. If the documentation which is submitted properly, then we can comment about whether the competence is adequate or not. So here actually we cannot comment because the documentation is incomplete. Okay, so that is the outcome five. Now let us go to the outcome six. Here outcome six is training is completed, all the competencies have been achieved completely in all the post and the training is completed. The candidate will be awarded completion of certificate of completion of training. CCT will be awarded. No additional time is required. It is the end of the training. So these are the 6 outcomes for the candidates or the trainees which you should know. There is outcome 7 and outcome 8 also that we will also see subsequently. But I hope these 1 to 6 you have understood it clearly, because most of the time there will be question on 2, 3 or 5. Okay, so because there are certain concepts which are here in outcome 1 and outcome 2, there is a little difference in here. Complete all competencies as expectation they are achieved. Here some competencies are lacking, but additional time is not required, so progression still can happen. While in outcome 3 there is an inadequate progress. So there is a difference between the 2 and 3. In 3 outcome 3, the inadequate progress is there. There are significant gaps as compared to 2. The gaps are significant, and hence the candidate requires additional time. Okay, so the extension is required here. Outcome 4 is the worst outcome. The candidate will be released. Outcome 5 is mainly deals with the documentation, and 6 is the CCT, that is a certificate of completion of training. Okay, now outcome 7. Basically, outcome 7 is for fixed term short training assessment or locum appointment for trainees. So generally outcome 7 is not asked, but we'll just cover it. So these are fixed term training post. Okay, now this outcome 7 is further divided into 7.1, 7.2, 7.3, 7.4. Okay, so these are actually specialist trainee appointments. So here in 7.1 there is a satisfactory progress. Okay, locum appointment for trainee, or it is a fixed term specialist trainee appointment. Okay, so there is a full competency, no additional time is required. It is equivalent to outcome number 1. Okay, then outcome number 7.2 is that there are targeted competencies which are needed. There are minor gaps, but there is no additional time which is required. So it is actually equivalent to outcome number 2. Then outcome number 7, outcome 7.3 is an inadequate progress. So there are major gaps. So additional time is required, which is equivalent to outcome 3. Okay, so 7.1 is equal to outcome 1, 7.2 is equal to outcome 2, 7.3 is equal to outcome 3. Okay, so once we have understood 1, 2, 3, you will understand 7.1, 7.2, 7.3. But these outcome 7 is after the completion of the training, when there are fixed term specialist training appointments or the locum appointment for the training. Okay, so for these candidates, these are the outcomes. Okay, then outcome 7.4 is incomplete evidence that there is a missing documentation. Additional time may or may not be required, and this is equivalent to outcome 5. Okay, 7.4 is equal to outcome 5 of this. Okay, so 7.1 is equal to 1, 7.2 is equivalent to 2, 7.3 is equal to 1 to 3, 7.4 is equivalent to 5. Okay, then outcome is out of program. The candidate is pursuing the research or other experiences, and actually it is not a clinical appointment which the candidate is doing. So not assessed for progression here. In outcome 8, the candidate is not assessed. So here actually outcome 1 to 6 most commonly they are asking. Outcome 7 is for FT, STA or LATs. Okay, but when they give the options, they will give you from outcome 1 to all these outcomes 7.1, 7.2, 3, 4 and outcome 8. So you will get confused. Okay, so remember, most of the time the outcomes are for 1 to 6. The questions are based on the 1 to 6, but 7 and 8 also you should know. The 7, they are for FTST or LAT. Okay, so these are fixed term training post. Okay, so how they are comparable to 1 to 6, that also we have seen. Now let's go to the further. So how to differentiate between the outcome 2 and outcome 3, because there are some competencies which are deficient in outcome 2 also, and outcome 3 also. So basically here in outcome 2, the progress is almost satisfactory, though few competencies are lacking, while in outcome 3 it is an unsatisfactory progress. There is no additional time is required in outcome 2, while in outcome 3 additional time is required. Here there are mild gaps, here there are significant gaps. So I hope you will be able to select whether the outcome 2 or outcome 3 is there. So if extra training time is required, go for outcome 3. Okay. Now another thing is the outcome 5 that you should understand. In outcome 5, that is there is a documentation issue. Training may be competent, but the portfolio is incomplete, so panel cannot judge the progress. So classically, if in the STEM they will use this particular terminology, insufficient evidence is submitted by the candidate. So that is the outcome 5. If you see this insufficient evidence submitted, we will select for outcome 5. Next is outcome 4, that is the exit from the training. It is rare but serious, may or may not include competencies. And here we have to think about if the STEM mentions about the persistent failure or fitness to practice concerns are there, that is the outcome 4. Okay. So the panel has noted that there is a persistent failure and unfit to practice. So that is the outcome 4. Now next is the outcome 6. That is the completion of certificate of training. Okay. So it is a completion of training ready for consultant role. Okay. Outcome 8 is not a failure. The candidate or the trainee is out of program pursuing some research, etc. So there is no judgment on the competence. Okay. So that is what is the outcome 8. Now, what is the purpose of ARCP? One, because of ARCP, there is an assessment of the progress. So this assessment of the progress is done against the curriculum competencies which are mentioned. Okay. Then it also gives the feedback to the candidate. So if we note the deficiencies early, there will be further improvement in that. So feedback is another important function. Third is the revalidation. It is an important part of the revalidation also. Okay. So annual full scope review is done, and it is important for the revalidation. Second is a patient safety. Okay. So it will note down the concerns which are there with the trainee, and it will give the important marker for the patient safety also. Then quality assurance. It ensures that the training standards are maintained. Now, what exactly this ARCP panel constitutes? Minimum, there are 3 members. One is a postgraduate dean, and second is a TPD, that is a training program director. Then there is a lay member, and then is an external advisor also. Okay. So what does this ARP panel do? So basically, they will review the educational supervisor's report, workplace-based assessments, what we have seen in the last session, then the exam review, and there is a reflective logs which are filled by the candidates. So all this is reviewed, and then the outcome is given. So there are 3 members. One is a postgraduate dean or training program director. Then there is a lay member, and then there is an external advisor. Okay. So commonly asked scenarios in the examination. Scenario 1 is about competent trainee but forgot to upload workplace-based assessment. So here is a outcome 5. Another scenario needs more surgical exposure, but otherwise the candidate is fine. Okay. More surgical exposure is required, but otherwise fine. That is the outcome 2. Okay. Then another scenario where there is a poor performance needs extension. So when the time is a factor which has come, that means it is an outcome 3. Another scenario, the candidate has completed all the requirements. The outcome is 6 years. That is a CCT scenario, completion of certificate of training, certificate of completion of training. Okay. Then scenario 5, there is a repeated failure and unsafe practice has been noted. So it is an outcome 4. The candidate will be released from the training. Okay. So what is the purpose and functions of ARCP? One, it is important for the progression because it assesses the trainee's progression against the curriculum. So there is an annual review and it is mandatory. So it is important for the progression of the candidate as far as the competencies are concerned. Second, about the competence. So it is an evidence-based judgment using workplace-based assessment. The logbook is taken into account. So competence is assessed with this, and it is not based on the single examination. Okay. Then patient safety. It identifies the unsafe trainees early, and the regulatory importance is also there. Then revalidation. It supports the GMC revalidation. Whole scope of the practice is there. And feedback. It identifies the learning needs and drives PDP. So ARCP is not just pass or fail. It is a formative plus summative. Okay. So this also you should remember. It is not just a pass or fail, but it is a formative plus summative. Okay. Then types of evidence which is used in the ARCP. So workplace-based assessments are seen. Then logbook is there. There is a educational supervisor's report. Multi-source feedback is there. Then exams, that is MRCOG part 1, 2, 3 exams. Okay. And the reflection, that is the whatever is mentioned in the e-portfolio by the candidate, that all is taken into account. So all these evidence is uploaded in electronic format, which will be reviewed by the panel. Okay. So workplace based assessment like mini CEX, then case-based discussion, directly observe, perform procedures. This is what we have learned in the last session, and that is one of the core evidence. Okay, then logbook, number of the surgeries which are performed or the procedures which are performed, that will give the objective skills proof. Okay, then education supervisors report, that is the global judgment, that also has got a very high weightage there. Then multi-source feedback, there is a team feedback, and it talks about the professionalism of the candidate. Then candidate is supposed to also give these Royal Colleges examination, that is MRCOG part 1, 2, 3. Okay, so whatever is required for that competency or for that grade, that will be taken into account. Then reflection, so e-portfolio entries, that will talk about the insight and professionalism. Okay, the concept of triangulation we have seen last time along with the learning. Okay, so what is triangulation? It is using multiple sources, multiple assessors, and multiple locations. Okay, so it improves the reliability of the assessment, like mini CX plus case-based discussion plus multi-source feedback and plus logbook. When you combine, you get a better overview of that particular candidate's competencies. Okay, so single assessment is not sufficient, and this is the multiple sources that gives the valid judgment about the competencies of the candidate. Okay, so this is what is the concept of triangulation, which we have seen in the learning session also. Then ARCP decision, on what principles this ARCP gives the decision. So first thing, it is evidence based on the documented proof. Okay, not the opinion based. So this is one of the important thing about the ARCP, that it is an evidence based on the documented proof. Then it is a structured, standardized national process. It ensures the fairness. It is transparent. Trainee can access the outcome, and important for the appeals, because the candidate can appeal the outcome. Okay, then it is defensible, legally robust, and important in disputes. Okay, so ARCP panel, we have seen what exactly the ARCP, how it is constituted, what are the roles and responsibilities, that we will see. Okay, so the panel as such will review the evidence, and not direct assessment. It is not a direct assessment, but the panel will review the evidence which is submitted. What is the role of the educational supervisor? He will provide the report, and that is the key contributor for this ARCP. Then there is a TDP, that is a training program director. He overall, he sees the progression of all the candidates, you can say, for that particular program, and decision influence is also there from the training program director. There may be certain changes which may be made in the competencies which are expected. Then external or lay member, that will ensure the fairness, and it is important from the governance point of view. Okay, so panel does not directly assess the trainee clinically. It reviews the evidence only. Okay, now coming to the educational supervisor's role, because every trainee will have some educational supervisor. So what he does, he assesses the candidate continuously throughout the placement. There is a report writing. The educational supervisor's report will be submitted to ARCP panel. The feedback will be given. The strength and the areas for the improvement will be mentioned in the feedback. And PDP planning is done. Personal development plan is then formed, because every candidate may have some different competencies requirement. Okay, certain candidates may be good in certain competencies. Then there will be PDP planning, that is the personal development plan. So education supervisor's report is the most important document in the ARCP. That also you should note it down. Okay, so there is a difference between the ARCP and appraisal. So ARCP is mainly for the trainees. It is done annually. There is a purpose, is the progression of the training, whether it is appropriate or not, that, and the outcome, formal outcome is given from 1 to 8. And who is the regulating body? It is the training body for that particular program. That is the regulating body. While appraisal is mainly for the consultants, that is also done annually. The main purpose of the appraisal is the professional development, but there is no numerical outcome which is given in the appraisal. And the regulating body is the GMC. It is mainly required for the validation. Okay, now what exactly this remediation and support is there in this ARCP? If there are minor gaps, that is the only targeted training, only in certain competencies there is a lacking. So it is the outcome 2 which is given. But if there are major gaps, the training extension will be given. That is the outcome 3. Then serious concerns are there, the candidate will be removed. That is the outcome 4. So ARCP is also supportive and not punitive. Okay. So there are common reasons for poor ARCP outcome. So what are the such common reasons why the ARCP outcome is poor? One, it may be because of the clinical skills, because the number of surgeries which are performed are less. Then it may be because of the knowledge, which is getting reflected that the failure in the examination. Then about the professionalism, there is a poor MSF, that is a multi-source feedback. It is not only the educational supervisor, but the team which is surrounding that particular environment. Those feedbacks are also taken into account. So multi-source feedback is very important. Okay, so that talks about the professionalism. Then the documentation, certain workplace-based assessments are missing. Then in that case, it will be the outcome 5. And engagement. So if the candidate is not having the reflection which are required to be fulfilled or uploaded into the e-portfolio. So these are the reasons for which there is a poor ARCP outcome. Okay. So about the clinical skills, knowledge, professionalism, documentation, and engagement. So if these points are lacking, then there will be likely to be poor ARCP outcome. Okay. So is there a appeal and review process? Yes, definitely. Right to appeal is there. Trainee can challenge the ARCP outcome. Grounds is maybe on procedural error or unfair judgment, and there is a formal review of this ARCP process once again. Okay. So there is a transparency and fairness. That is the key principle over here. Okay. And this is also linked with the patient safety and governance. So early detection will identify which are the trainees which are struggling, and those trainees can be given special attention. Then there is a risk reduction, so that prevents the unsafe practices, and there is an accountability. Okay. It ensures the standards also. So what exactly we should remember from examination point of view? ARCP is not just the exam result. Okay. Exam failure alone is not outcome 3. Okay. Must consider overall competencies. Outcome 5 does not mean the poor trainee. It means the poor documentation. And educational supervisor report is the key report here in ARCP rather than most of the things. So that is the strong influence on the outcome. Then there is a triangulation concept that also we have seen, which is a gold standard. It is the multiple tools, multiple assessors, and on multiple occasions. Okay. So ARCP both formative plus summative. So not just a judgment, it also important for the improvement in the candidate. Okay. So just for the quick revision, ARCP is the annual competency review. There is a triangulation, that is a multi-evidence resources. Then educational supervisor's report is the most important document. Outcome 5 is the missing evidence. Outcome 3 is needs extra time, and panel role is to review the evidence and not the assessment of the direct assessment of the candidate. Okay, so that finishes the topic about the ARCP. Doctor, we have few questions. Can you please go through these questions?
A trainee has excellent surgical numbers and has passed all exams, but has poor multi-score feedback, indicating concern about teamwork and communication. What is the most appropriate principle guiding ARCP decision making? A. Examination performance outweigh professionalism. Surgical competency is the primary determinant. All domain must be considered equally. MSF is unreliable. Only educational supervisor report matters. So it is C. All domain must be considered equally.
So all domains must be considered equally. ARCP uses holistic assessment across multiple domains. So it is the clinical, academic, as well as professionalism. And this MSF, multi-source feedback, talks mainly about the professionalism. Okay, professionalism concerns are critical and can affect the outcome despite good exams. Next.
But if this multi-source feedback is bad, then also it is given ARCP 3.
So it will depend upon the severity, basically. We will not go much into the details of that. The concepts we will understand from the examination point of view now.
Okay.
Okay.
Which of the following best describes triangulation in ARCP assessment? A. Repeating the same assessment tool multiple times, using different assessors for one assessment, combining multiple tool assessors and occasion, using only objective assessment and relying on supervisor judgment. So it is C, combining multiple tools, accessors, and occasions.
Yes, combining multiple tools, assessors, and occasions. So triangulation is multiple tools, that is mini CX. You can add then CBD, multi-source feedback, multiple assessors, multiple occasions. That will ensure the validity plus reliability. Next.
Which statement regarding the ARCP panel is correct? It directly assesses clinical competence. It conducts workplace assessment. It reviews evidence submitted in the portfolio. It replaces the role of educational supervisor and it performs final clinical examination. So C is the answer. It reviews evidence submitted by the in the
Yes.
portfolio.
So it does not directly assess the clinical competence. Okay. So it reviews the evidence
Reviews the
submitted, yeah, in the portfolio. So panel is evidence review body and not examiner, does not directly assess skills. So educational supervisors report plus workplace based assessment plus logbook, all these will be taken into account. Next.
a trainee submits incomplete workplace assessment documentation due to technical issues but is otherwise competent. What is the key principle guiding ARCP corresponds? A. Competence overrides documentation. B. Documentation is essential for the judgment. Supervisor opinion alone is sufficient. Exam compensate for missing evidence. MSF is sufficient. So it will be documentation is essential for judgment.
Yes, documentation. So what outcome will be given here?
5.
Yes, outcome 5. Okay. So documentation is essential for judgment. ARCP is evidence based. If evidence is missing, cannot judge. That is the outcome 5. Next.
Which of the following best reflects the role of the educational supervisor? Final ARCP decision making authority, conducting ARCP panel review, continuous assessment and report generation, only assessing examination, and providing legal oversight. So it is C, continuous assessment and report generation.
Yes, continuous assessment and report generation. So educational supervisor role is an ongoing assessment, giving the feedback and preparing the report. Next.
Which scenario based demonstrates failure of triangulation? Mini CX by three different consultants, CBD, MSF, logbook review, multiple jobs across relation, single CBD used to judge overall competence, combination of formative and assessment. It is D, single CBD used to judge overall competence.
Yes. So single assessment is actually of no use. Single CBD used to judge overall competence. So single tool is not reliable. Use multiple tools and multiple resources. Sorry.
Which of
Next.
the
Uh,
following is the most important document influencing ARCP outcome? A. Logbook, second MSF, third examination result, D. Education supervisor report and attendance record. So it is D. Educational supervisor report.
yes. Educational supervisor's report is global synthesized judgment carries highest weightage. Next.
A trainee demonstrates good clinical skills but lacks reflective and entries. Which competent domain is primarily affected? Clinical knowledge, technical skill, professionalism, communication, examination, performance. It is C, professionalism.
Again, it is C only, professionalism. Okay.
C,
So
professionalism. Yes.
reflective portfolio entries that talks about the insight and the professional development. Okay. So lack of reflection is the professionalism concern. Next.
Which of the following best describes the primary purpose of ARCP? To rank trainees, to identify failing trainees only, to assess progression against curriculum, to replace examination to provide certification. It is C, to assess progression against the
Yes.
curriculum.
Yes. It is the assessment of the progression against the curriculum, and competency assessment is done here. Next.
A trainee has conflicting assessment, strong mini-6 but poor MSF. What should the ARCP panel rely on? Ignore MSF, consider only mini CX, use triangulation to interpret evidence, repeat assessment only, base decision on exams. So use triangulation to interpret evidence.
Yes, so here the triangulation will be taken into account for giving the judgment. Use triangulation to interpret the evidence. So conflicting evidence, use multiple data sources and there will be balanced judgment. Next.
Which of the following is a key principle ensuring fairness in ARCP? Subjective judgment, supervisor preference, standardized national process, individual discretion, and examination only criteria. So it is C, standardized national process.
Yes, it is a standardized national process. Okay, so ARCP is structured, standardized, and
Structured and
transparent.
transparent, yes.
Yes.
Which scenario best describes ARCP's role in patient safety? Promoting research activity, ensuring exam success, identifying unsafe trainees early, increasing training duration, and improving attendance. So it is C, identifying unsafe trainees early.
Yes, so that is what is the important role, identifying unsafe trainees early. So core governance role and it protects the patient safety
Patient
also.
protection.
Yeah, next.
A trainee disputes ARCP outcome, citing unfair assessment. What principle supports their right? A. Supervisor authority. B. Transparency and accountability. Examination supremacy. Panel autonomy and documentation bias. It is transparency and accountability.
Yes, a trainee disputes ARCP outcome citing unfair assessment. So the process has to be transparent. So it reflects the
Trainee can
transparency and
challenge.
yeah. So
Trainee can
ARCP
challenge.
must be transparent, defensible, and open to appeal. Okay.
Yes.
Next.
Which of the following best differentiates ARCP from appraisal? A. Both assess trainees, both provide outcomes. ARCP is for training progression and appraisal is for the consultant. So C is the answer.
Yes. So ARCP is mainly for progression for the trainees. So ARCP is training progression. Appraisal is for consultants. Okay. Next.
A trainee has excellent evidence but fails to engage with feedback and shows no improvement. Which concept is more relevant? He has excellent evidence but fails to engage with feedback, shows no improvement. One is knowledge deficit, technical incompetence, lack of insight, documentation error, examination failure. The documentation error,
That fails to engage with the feedback and shows no improvement. Which concept is more relevant? A trainee has excellent evidence
it
but
is
fails to engage with the
5, I
feedback.
think. Documentation error. He had failed to engage with feedback and
A lack
showed
of
no
insight. So
lack
insight
of
is a
insight.
key professionalism domain and failure to act on feedback. That is the major concern. Okay. So
Okay.
he fails to engage with the feedback and shows no improvement. So that is because feedbacks will be more important and that is the reflection of this insight, no key professionalism domain. So failure to act on the feedback is a major concern. So there is a lack of insight. Okay, because he fails to engage with the feedback and shows no improvement. The feedbacks are made for the improvement. So the more appropriate will be the lack of insight because he has performed, he has been given the feedback, but there is no improvement in spite of the feedback. So that there is a lack of insight.
Okay.
So triangulation is the gold standard. Educational supervisor's report is most influential. So panel will review the evidence only and not directly assess the candidates. Outcome depends on the whole portfolio and professionalism issues are the major headlines. So that finishes the topic of ARCP outcome. Thank you.